So the inspiration for this work, really a set of circumstances that inspired this work. There's an ongoing youth and young adult mental health crisis in New York City and across the country. In 2023, 50% of young people in New York City screened positive for depressive symptoms, and there's a shortage of mental health professionals and school-based social workers that work with these young people. We have high turnover and vacancy rates in for these positions in New York City and elsewhere. And so the current workforce in training, our students need to be ready to step into these roles. At the same time, practicum experiences are less and less effective for many students. Our community partners, the social work organizations, are overburdened and underfunded. And supervisors, as a result, have less time, less capacity, less energy, honestly, to focus on teaching and intentional skill development with our students. We need innovation in social work education. We need new models, new ways of educating social work students. And one of those models is simulation. Simulation is observed, simulated, but realistic and immersive practice in which students learn social work skill development. They then reflect on that practice and use this new knowledge, new meaning in their future practice with clients. We want to develop the most effective methods of helping our students gain clinical social work skills to work with diverse populations across a variety of contexts. So we've been working to integrate simulation into Silver's curriculum for a few years. In this pilot initiative and this teaching note, my co-authors, Dr. Nick Lanzieri, Dr. Gabby McBride, and Dr. Jasmine Acevedo and we wanted to share our process and the lessons learned with other social work educators. We wanted to share what worked well and what can be improved. The process we describe is really about how we embedded simulation into the practice curriculum and how we craft pedagogy around each of those simulations in order to engage students and make the learning meaningful. And the more we work with simulation in the curriculum, the more apparent it becomes that the pedagogy around simulation is just as important, if not more, than the quality of the simulation experience itself. This may be, as far as we know, the only initiative and subsequent teaching note that describes the process of embedding 5 simulation experiences, both tech-based and actor-based, across a full year generalist practice course. And then after completing this paper and using some of what we learned from the initiative, Dr. Lanzieri and I submitted a proposal and we were awarded $300,000 from the Booth Ferris Foundation to expand and deepen simulation integration here at Silver. Some of the important takeaway messages from this paper. I think the first one is that simulations need to be thoughtfully scaffolded and integrated in the curriculum. We offer 2 tables outlining how we did this for the reader, and we hope those are useful if they want to go about the same process of integrating sim into their curriculum. The second takeaway is that preparation for simulation is key. We can't just expect that students understand why simulation works how it works or what the value is. The simulation trainer or instructor really needs to pay attention to how we prepare students with enough time, enough dialogue, listening to their concerns so that we can reduce anxiety and increase their capacity for risk-taking and learning. Our students displayed high anxiety about simulation-based learning, about their performance overall. Cognitive overload was an issue for some students. They're just simply not used to being observed in practice as those in other health professions have been, like nursing and medicine, for years. Observation of practice rarely occurs in the practicum environment. The next and sort of final takeaway, I think, is that supporting instructor development and generating instructor confidence is also key. For many instructors, using simulation to teach and considering replacing their written assignments with simulation-based assignments, This was new and it was daunting. They found it daunting. So our instructors wished for more preparation for themselves and for the students to support the same issues I just mentioned, anxiety and cognitive overload. And for the instructors in particular, they wanted more support around tech management. So, in short, instructors, if they're asked to integrate simulation into a practice class, they need time, preparation, dialogue with their trainers to develop the confidence to really implement this work effectively with students.